All right, so we talked about mindset in the last video. This time we're going to talk about the actual approach. So how do you translate that mindset into a tangible approach, into a tangible next step? So the two things, I want you to remember two key steps for your approach. Number one is get very clear on why you are applying to medicine and why you want to go to that school. Because let's be real, if you can't convince yourself that you want to do this, how are you going to be able to convince other people? How will you convince 5 people on a panel looking at you, assessing you, judging you about your answers and what you want to do, that you actually want to do this? If you yourself don't believe it, and if you yourself don't feel like you could do this or you want to do this. So that's my number one approach for you. Like, get very clear on why you're doing this. And it's good to just ask yourself these questions, like, why do I actually want to do medicine? Like, whether it's journaling, whether you want to talk to friends or family, whatever it might be that might help you kind of start thinking about this. The way you prepare for this in advance will show during the interview, because they're going to ask you, it's like, why do you want to be a doctor? And then hesitation, unsureness, like flipping, flopping in your answers. It's just going to show. And then they're going to be like, all right, this guy's clearly not serious about it. He's not really thought about it. So just the fact that you're going to think about it in advance will actually be very beneficial for you. So I would recommend that you start thinking about why you want to do this. Get very clear. Personally, I've known I want to be a doctor ever since I was really young. In grade 6, we had an assignment that said, hey, what do you want to be when you grow up? And I put like neurosurgeon, thinking that would be so cool, like to operate on brains and take out cancers and stuff. And that was the first elective that I did in medical school. And I'm like, okay, this is too boring. And it's like microsurgery, micro movements for like 12 hours. I'm like, that's not it for me. That's not my personality. So I didn't really fit that, but that's fine. But that was what motivated me back then. And so, you really have to figure out why you want to do it. And the second main important approach, the key step in your approach, is to show, don't tell. So now I want you to think about this time, at any time you're approaching any questions, any preparation, I want you to think about showing them and not telling them. And what this means is when they ask you, like, who are you? Hey, tell us about yourself. If you go on and start saying like, hey, I'm a very motivated person, I'm a very hardworking person, I'm a passionate person, I like helping people, you're just telling them who you are. It's more effective if you're able to share a story of you helping someone. Then they hear the story, then they can reach their own conclusion that, hey, this guy is hardworking, or hey, this guy is actually a kind and nice person who helps other people. So the key here is to tell the story that's your story, that then allows them to reach the conclusion that you want them to reach. I hope that makes sense, because it's 95% of the people go straight to just telling. They just say, I'm a hard worker, I'm passionate about medicine, that's why I want to do medical school. You're like, great. Every single person has said this in the interview. So as an interviewer, like when someone tells me that, I'm like immediately falling asleep. I was like, okay, well, this person really hasn't thought beyond the basic surface level. And so part of the approach I want you to think about is like getting to that deeper level of why you're doing this, and then the stories that explain and justify the why you're going into medicine. And that's going to give you probably the strongest approach you can have during any of your interviews. And this applies both for like the medical school, residency, and fellowship too. Like they're going to be asking you like, why do you want to do interventional cardiology, which is a subspecialty or fellowship? And if you're just like, oh, it's cool and I like doing the procedures, like that's not as strong as someone saying, hey, actually I had this one case and blah, 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 blah. This patient came in with STEMI, cardiac arrest. We stented up a couple LED, left circumflex. The patient ended up surviving, got off the ventilator, and then lived. And you're like, oh, okay, this guy actually thinks about what that entails and saw the positive impact becoming an interventional cardiologist can have. And that's why he wants to apply. And so that's what the interviewers now think, and like actually think highly of this individual now, as opposed to someone saying, hey, it's cool. I like the cool gadgets and the cool procedures. So you can see the difference in the depth of the answers. And that's really what will make a difference in a successful interview versus a non-successful interview. Now, another thing I want to touch base in this point is, I talked about earlier, is getting clear on the why. And if you're not clear on the why, or if you're unsure if you even want to do medicine, my simple answer to you is that it's okay. Because I would tell you probably a good chunk of good chunk of students applying to medical school are actually unsure. And I was feeling unsure too, like in first year undergrad, second year undergrad. I had a full ride scholarship in first year undergrad, and I lost it because of, kind of partying, met a lot of people, was playing a lot of sports. I was just having fun. And I was basically borderline academic probation after first year. So needless to say, I lost my scholarship. And then second year, I got a little bit better, but I still wasn't serious about getting into medical school, even though I kept saying I wanted to be one ever since I was very young. And what changed it for me was an experience I had when I went to India and did some medical volunteerism, they called it. Essentially, it was an HIV positive orphanage run by two very gentle, loving souls. There was a couple. And the orphanages were patients or kids, I guess, who were abandoned and left on the street because they were HIV positive and the parents didn't want to take care of them. And this couple would take them in, take care of them. So I went there for 3 weeks. I lived with the kids, showered, ate together, played together, danced together. I would take them to school. I'd take them to their hospital visits. I'd give them their medications. I got such a close bond with them that when I was leaving, I was crying because I felt that, our bond was so strong and I felt I wanted to do something for them. And I took all that and channeled it into creating like a nonprofit organization in our school when I got back. And that was probably one of the biggest things that helped my application and helped me get into medical school. But then I got serious after that. Then I crushed my third year, fourth year, crushed the MCATs, crushed the interviews, and then I got into med school. So, my first advice to you is if you're unsure, try various medical experiences and see if any of them will spark an emotion like it did for me, or if it sparks any sort of interest. And it could just be some sort of an interest. You're like, actually, this is kind of cool. This facial reconstruction surgery that I shadowed and I saw, I love that. And the patient left with so much confidence after the fact. I would love to be able to help people in that way. So, helping people is a good answer for a lot of things, but you don't want to just tell it. You want to show it. And that's what the stories are for. And that's why you try these various experiences, so you can collect the experiences, but also the stories. And then hopefully some of them spark an interest or an emotion that will then make it clear for you what you want to do or what you don't want to do. And it may be that, hey, maybe med school is not for you, and that's okay. But the clarity is going to be worth it. Number two, if you're like later in the application cycle, maybe in fourth year, and you don't want to wait, which I don't believe in actually. There's people who are like mid-30s apply to the medical school and get in. So there's really no rush. You can apply after fifth year. You can apply after a master's. You can apply after a gap year. There's really no right way of doing it. It's whatever feels comfortable and best for you. So I would say if you don't want to get more experiences and you're like, okay, I still want to apply this cycle, then what you can do is think back to earlier experiences you might have had with the medical field. And if you can't remember anything, like a broken bone time or anything like that, then think about, or ask your parents. Ask them if they remember any medical encounters. Ask your cousins, aunts, relatives, and just try to get any story that you can. Because again, the stories is what's going to really matter. When you show the stories, don't tell about it. And so I'd recommend finding medical stories that are being very close to you, and then you can use them as examples. And then one pitfall I would avoid is if you are unsure, it's okay. It doesn't mean you don't apply to med school. It doesn't mean you don't do interviews, any of that. But the uncertainty will definitely show in your interview process if you're not clear. And if you're unsure, it's okay. But I would still say avoid generic answers. Like, don't say, I just want to help people. I'm hardworking. I'm passionate. Think about actual stories that will help you convey why you are pursuing this, why you're sitting there in front of them wanting to be in medicine. And you don't have to be 100% sure again, but stories go a long way.